in order to keep costs down, one of the things that would be done in this insurance store is to insert some competition. Because right now in New Jersey, about 2/3 of the insured are insured by one of two companies. Oh, you hear that there are hundreds of insurance companies out there. In fact, from the point of view of most New Jerseyans, there are two insurance companies. It's not a lot of competition. Competition. Well, that's exactly what this does. That's what this store, this company store, this insurance store will inject some competition in the system.
I want to go to your store.
And this is what you've heard a lot about.
Your health care.
One of the plans in this insurance store would be a government-operated plan.
Why?
And let me finish. This insurance plan, well, okay, let me just say at this point, some of you might want to be considerate of the other people in the room who do want to hear.
You stop both of us.
So what this plan would offer is very much what the other plans would offer. For the insured person, it would look a lot like Blue Cross or Aetna. It would. This will offer competition from a company that is nonprofit, from a company that is tied to best medical practice, so that it can inject best medical practice into the delivery of medicine, and that this plan will be offered like any of the others in the company store, in this insurance store. My guess is that because it will probably be a little bit less expensive, some people, and probably will offer care in a different way, perhaps a better way than some of the privates. I think a number of people, probably not half, who are eligible for this this array of plans, will select it. Will select it. So that's the second part of the bill. The third part of the legislation has to do with Medicare. Medicare overall is a successful program.
No, it's not.
Well, the definition, I'll tell you what I use as a definition to say that Medicare is a successful program. Patients like it, doctors like it, it is efficient, and it is solvent. So that's, and in answer to questions, I will talk more about that. It provides good health care to 40 million Americans.
Isn't it
And it works. Now, over the 4 decades that Medicare has existed, from time to time, changes have been made so that it provides better care. For example, it didn't used to cover prostate cancer screening or mammograms or flu shots. Over the years, we've added those. That provides better care for Medicare beneficiaries. And there are a number of other things of that. From time to time, those upgrades have been made to Medicare. This legislation would make some additional upgrades to Medicare. For example, it would create a medical home. Right now, an awful lot of Medicare patients self-diagnose and then go shopping for a specialist. That adds cost. That's expensive. If there's a medical home where the patient can go, where a doctor knows that patient will, that Medicare beneficiary will be treated as a patient, not as an object on whom procedures are done. Other changes.
Sir, are you guys taking that plan? Are you guys taking that plan because you're forcing it down on yourself and you're not taking it yourself?
When I am eligible for Medicare, which is not many years away,
about the healthcare plan
I expect to take Medicare as well.
Yeah, okay. It won't be there.
There will be standardization of claim forms, there will be better electronic records so that your medical home will know what tests you've had. So you won't be sent for redundant and wasteful tests or even dangerous tests.
We don't want it, sir.
You will be
Could you be quiet so I can hear what the speakers say?
you will get more primary care and therefore less wasteful tests.
Yeah, okay.
So there are some other changes that would be made to Medicare, but essentially those are the three parts of the bill. Standards for those companies that provide insurance to most Americans. An opportunity for people who are not now served by the system to get group rates, and some improvements in the way Medicare delivers health care and pays doctors. For example, one of the improvements is that there will be greatly increased payments for primary care physicians. One of the first things this legislation does is stop a scheduled 20% cut to doctors' fees. So that the doctors don't drop out. So there are some other things in the bill. For example, there's tuition aid for nurses. There's more opportunities for nursing faculty because there's a shortage of nursing faculty. And there are tuition assistance for doctors who want to go into primary care and some other things like that. But principally, the bill has those three parts. It does not have a death panel. It does not have a government takeover. It does not have any assistance for health care for illegals.
There's no way.
So that's the system. So now let me turn to your question.